Hello, everyone, and welcome to this installation of BD Live, Black Doctor Live. And today we're going to be talking about from holiday gatherings to New Year beginnings, how vaccines play a part in your seasonal health game plan. Thank you all for joining us. My name is Dr. Ashanti Carter, and I serve as the Chief Academic Liaison to blackdoctor.org. So, we have some esteemed panelists here. They are power packed and they're going to give us what we need to learn all about vaccines and keeping ourselves safe. Of course, I have to thank our sponsors, Bio, for powering this great conversation. So as you know, the holiday season, it brings joy and togetherness. But you know what? We don't want to share together. It's germs, okay? So there's some health risks for older adults, especially respiratory illnesses like the flu, RSV, and COVID-19. You guys may think COVID-19 is over, but you know what? It ain't over. It isn't over at all. And you can even hear it in my throat. I'm getting over something. So it's very important that we have this conversation. So I would like our panelists to come to the stage. Let's give them a round of applause. Woo! And I'm going to have each of them introduce themselves. And I'm going to start with Dr. Renee.
Hi, I'm Dr. Renee. As many of the Black Doctor audience knows me, I'm host of the Ask Dr. Renee show, and I am the allergy and asthma expert.
All right. Thanks, Dr. Renee. Dr. Caldwell, come on off mute and introduce yourself to the people.
Good evening. I'm so happy to be joining you guys again. My name is Julie Caldwell. I am a senior manager at Walgreens, and I lead our immunizations team. So doing everything we can to make sure you've got vaccinations at your fingertips when you need them.
I know that's right. Okay. Dr. Brooks, introduce yourself to the audience.
Well, thank you very much, Dr. Carter. Thank you for having me on this esteemed panel. Dr. Oliver Brooks, I'm clinical professor of pediatrics at Charles R. Drew University of Medicine. I'm a retired chief medical officer at Watts Healthcare Corporation, South Los Angeles, and FQHC. I practiced peds there for 30 plus years. Past president of the National Medical Association, and I'm a past member of the ACIP, which is the CDC panel that determines vaccine policy for the United States.
I love it. Dr. Anastasia Williams.
Hello, everyone. I'm Dr. Anastasia Williams, pediatrician. I am the clinical director of pediatrics here at the San Fernando Community Health Center, where I'm squeezing this in between patients. Sorry for the blurry picture, but I'm always happy to join in the discussion about what you should be talking to about in terms of vaccines and keeping your children and your family safe. It's all about trust, and I want my patients to trust me. Thank you. I am president of the Association of Black Women's Physicians. Forgot to say that, Dr. Shah.
Say it one more time, Dr. Williams.
I am the president-elect for the Association of Black Women Physicians. Thank you. You want me to keep talking?
Well, I can go ahead and go. Good evening, everyone. It's so nice to be with you this evening. I am Allison Hill. I'm Director of Professional Affairs with the American Pharmacists Association, and I'm really excited to be here talking about vaccines. I am a licensed pharmacist, and so I've given many vaccines over my career.
Wonderful, wonderful. Thank you so much. And apologies for any technical difficulties, you guys. You know, that's just technology, that's what it is. So thank you for introducing yourselves to the audience. And so let's begin the conversation. Okay, so why is it that this time of the year matters to us? So the holiday season, it's the start of a new year, and it's such an important time to think about vaccines and preventive care. So why should we? Why should we think about this? I'm going to start with you, Dr. Brooks. Why should we think about, vaccines and preventive care as we're going into the holidays?
Well, I would say two main reasons and maybe a few others. First of all, we are in closer contact with our family. And when we are like that, we're hugging, we're sharing, we're laughing. So we are sharing at the same time secretions. And those secretions can hold respiratory viruses. The viruses that we're referencing, that we think about, COVID-19 virus, influenza virus, RSV, respiratory syncytial virus, they are at higher levels during the fall and winter. So you got higher levels of vaccines that can kill and hospitalize, and you got closer contact with individuals, and they can therefore be susceptible. The other thing is that a lot of times we're traveling. So then now you're in a milieu where you're on a plane, you're in an airport, maybe a train. So I just took the train a couple of weeks ago. So now you're around a bunch of other people more so than you normally would be. And who knows what their status is. People are generally not wearing masks that much now. And these three viruses I mentioned, COVID-19 vaccine, influenza, RSV, they are all infections that are preventable, reducible with vaccines.
Excellent. Thank you. I want to pass it over to our pharmacist, but Dr. Caldwell, please talk to us. Why should we be concerned about vaccines during the holiday season?
Well, I don't think we should be concerned about vaccines as much as we should be concerned about the bugs that they can prevent. Like Dr. Brooks said, we're in closer quarters. We're indoors a lot more. We are laughing, talking, and catching up with our loved ones. So we are definitely going to be in closer proximity and sharing those respiratory droplets, whether we want to or not. And while we're moving around a lot more and closer contact, the viruses are also moving around. So we've had a mild season so far. It's already been, close to December. We're getting it. Thanksgiving is next week, and we haven't seen a ton of flu activity. But even in just the last week, that has started to change. And regardless of the fact that we would like it to be mild, this comes every year. So every year at this time, we are talking about getting vaccinated, protecting yourself, protecting your loved ones. And that's really a key thing to state, and you can't state it enough, that you're not just protecting yourself with a vaccine, you're also protecting the health of others. And you don't know what persons that you may be around who may be a lot more susceptible to illness than you are. So while you may not be at high risk, just by being vaccinated, you're really helping out those you love and those that you're going to be around.
Excellent. Thank you for that. So, Dr. Renee, how can vaccines help best protect our loved ones, especially our older relatives, young children, or those immunocompromised during the holiday celebrations?
So it's one, if you're vaccinated, then hopefully you're not sick. So then when you go around these older people that are immunocompromised because of whatever ailments they might have or comorbidities they might have, it would definitely help to not get them sick. And then, of course, we know that small colds to an older person that, is, 70, 80 plus can be a whole, ordeal, ending up in the hospital and all sorts of things. So it's really important that we keep these people safe. And so that's why it's so important that the children are vaccinated at the appropriate ages that they are, and then that the adults are as well. And then, of course, the seniors, there's vaccines that the seniors need to get, like RSV and of course, COVID and of course, flu vac. And it's also, as an allergy and asthma expert, I have to say, all three of these affect the lungs. So it's really important for people that are around asthmatics like myself and people who have chronic obstructive pulmonary disease or other lung issues. It's really important that we get our vaccines because what vaccines do is they will help us to have, if we do catch anything, hopefully it'll be a lighter load. It won't be such a bad, strain that we won't end up in the hospital or something. And so we'll be able to get through it. And so that's why it's really, really important for people who are immunocompromised, and especially our elderly population, to make sure that you get them vaccinated.
Excellent. Excellent. Thank you. So this question is for Dr. Brooks and Dr. Williams. So which vaccines should people prioritize this season, and why are they so important not to skip? You first, Dr. Brooks.
Okay, so I would prioritize all of them because there's no reason not to. Although,
Okay.
Influenza, I'll start with. Influenza is especially important, and especially for those that are 65 and up. Those have significant underlying conditions. So influenza is indicated for anyone, I usually say, who can crawl. Okay. So because an infant generally crawls around 7 months, indication is 6 months and up. Okay. If you can crawl, then you should get influenza vaccine. Okay. COVID-19 vaccine is the same, is indicated for all 6 months and up, but especially, that was a good question though, especially children 6 months to 23 months of age. They have high rates like 50 to 65-year-olds. Those under 6 months who can't get vaccinated, same rates as those 75 and up. So how do you protect those infants? By getting yourself vaccinated. And then lastly, RSV is recommended only one dose. So it's a respiratory virus, but you only get one dose. Influenza and COVID are every year. You get one dose if you're 75 and up, or 50 to 74 if you have an underlying condition. And lastly, pregnant people. You get one dose if you're pregnant 32 to 36 weeks of age. And if you don't, then your infant needs to get what's called a monoclonal antibody, either nirsevimab or clesrovimab. And the women get it between September and January. The babies get it between like October and March. So it may sound like a lot, but when you go see one of these docs here and you need your vaccine, you say, this is me, this is my age, this is my family, what do I need? We'll know the answer. You don't have to worry about that. But if you can crawl, you need a COVID-19 vaccine, you need an influenza vaccine. Let's just make it simple.
All right. Dr. Williams, what do you have to add to that?
I agree with everything Dr. Brooks said. All vaccines are important, and being a pediatrician, that's what I'm going to say. But the thing I really want to stress is that, the holidays are about love, right? Loving our families, loving our grandbabies and children, grandparents. But at the end of the day, getting vaccinated is one of the best ways you can show love to your family. When it's raining outside, right? It's big. We're getting a lot of rain here right now. And when it's raining outside and it's raining, you get your umbrella out, you put your raincoat on. It's not going to stop the rain. It may not keep you fully dry, but it's going to keep you drier than you would have been if you were not prepared. We know that the winter months, the fall and winter months, are the time of year when we see the flu, when we see RSV, when we see COVID. And for those of us like myself as well, Dr. Renee, who have asthma, and as you get older, you're at even higher risk for developing pneumonia. So you should probably even be getting a pneumonia vaccine and shingles. All of these vaccines are important. They're not going to prevent you from getting sick at all. Okay, that's the mistake that people make. They think that we are saying that if you get vaccines, you won't get sick.
Right.
If you use your umbrella, you're going to get less wet, but you shouldn't get soaked. So we need to keep it in perspective. We want to protect our loved ones. We want to protect grandma from getting COVID and ending up in the hospital. We want to protect the newborn baby from getting RSV that can make them very sick with like a bronchitis, like bronchiolitis illness. So at the end of the day, all vaccines are important. Those ones that are common in the winter months when it's raining, flu, RSV, and COVID are the ones you need to get vaccinated for while you're dry. Get that umbrella out, get your vaccine to keep you and your family safe.
I love it. I love it. Get your vaccines. It's just like an umbrella. Yes, it covers us. I love that, Dr. Williams. Okay, Dr. Bell, I want to invite you into this conversation. So there are there particular groups such as those with chronic conditions? So we heard about with Dr. Renee, she talked about being an asthmatic, as well as with Dr. Williams, right? So, are there particular groups such as those who, have these chronic conditions or older adults who should be especially attentive to staying up to date on their vaccines? Uh-oh. Did I lose you? Did you hear me, Dr. Bell? Uh-oh. Am I frozen?
No, you're not frozen, Dr. Hill.
Dr. Hill.
Oh, I'm sorry, Dr. Hill. I apologize. You guys, I'm not wearing my glass. I think I should put my glasses on.
But you look so cute.
Glasses are cute
Sorry,
too. It's
Dr.
okay.
Hill. Whoops.
I was trying to figure out who exactly you were referring to, but
yeah, I was like, all right, because I'm like Dr. Bell, and I sound, but the thing is, look. And it's a BD live, so that's okay. That's okay. But I was so convinced, and I was just so convicted. And yes, your name is Dr. Allison Bell. So convicted. All right, Dr. Hill, I apologize. Go ahead.
No, it's okay. It's perfectly fine. But I think we need to really focus on how we are protecting our communities. I love the way that Dr. Williams just talked about with the umbrella about the best defense. And vaccines are really our best defense to protect each other and our loved ones from these preventable respiratory diseases. The particular groups that we need to worry about to make sure that they are not going to be as affected or go to the hospital will be our older adults who are 65 and older, also our younger people, our pediatric patients, and also making sure that we stay up to date with our vaccines. And a good way to stay up to date with our vaccines is talking to your primary care provider or talking with your pharmacist. Your pharmacists have access to a system that is called Immunization Information System, and they can look up every vaccination you've had, whether it was at your doctor's office, whether it was at your pharmacy, and they can have that conversation with you in order to find out which vaccinations you need and make sure that you and your family and everyone stays protected.
Okay, wait. So, Dr. Hill, you're telling me that I can walk into CVS, which is where I get my medications, and I can give them my name and my birth date, and they can look up my immunization history?
Yes, can look up your vaccination history. Also, a lot of our community pharmacists, they send you reminders, especially for the respiratory season. So you may be getting a text message or a phone call. It's saying it's time to get your influenza vaccine or it's time to get your COVID-19 vaccine. Yes. And pharmacists are able to be there and counsel you over the vaccines that you may need, not just your respiratory vaccine.
See, and I think that's so wonderful because we see our pharmacists and our pediatricians and other healthcare professionals coming together for the team, and it's a team of you, a team of YOU. So that makes me so happy. So what you're saying is there isn't an excuse. Oh, I forgot, or I'm so busy, or I don't know which vaccinations which vaccines I need. I don't know. So we have it all thought out for you. That's wonderful. That makes me so happy. So you guys, you're getting this information, right? There's no excuse, none whatsoever. So now let me put on my public health hat. And I have this question for you, Dr. Renee. So what role do vaccines play in addressing health disparities, particularly among underserved populations and communities of color?
So what we found out, and I think us in the community knew, but everyone else found out that a lot of us don't have a primary care physician and don't see the doctor regularly. So if you don't do that, then the least you could do is get your vaccine. So then hopefully you won't have to go to the urgent care or to the emergency room, and because we live multi-generational a lot of times, Or you're a caregiver like myself. If you get sick, you're going to get the other person sick.
Yep.
They're immunocompromised. So clearly, if something comes in the house, they're going to catch it. So if you stay on top of things with your vaccines and you keep your, wash your hands and all of the things to make sure you don't get sick, then you don't get the other people sick, and we're, less hospitalizations. And as we know, we have all sorts of issues with not having the access to care. Maybe there isn't a hospital nearby. Maybe the doctors aren't close by. All the reasons that we can't get regular care. At least stay on top of the vaccines, because I'm sure you go to the drugstore for something. If it's not for chips, you go for something. You know what I mean? So at least go to the drugstore and get the vaccines. They bring that to you, because there's drugstores on a whole lot of corners. There's more drugstores than there are, unfortunately, of course, the urgent cares and the doctor's offices and all of that. So if you could at least get your vaccines, then at least you might have that umbrella, like Dr. Williams, which I will be using that analogy from now on. Thank you so much, and I'll give you credit. But at least you have your umbrella.
Right.
May I add something to that, Dr. Carter?
Of course, Dr. Brooks, jump in.
So, in terms of the public health aspect, first of all, the more people vaccinated, the less likely a virus is to spread. But number two, and importantly to our audience, unfortunately, African Americans tend to have the highest rates of everything bad and the lowest rates of everything good. A. B, those with, let's say, kidney disease, liver disease, COPD, obesity, diabetes, if they get infected with COVID or RSV or influenza, tend to have worse outcomes. So it is even more important for our community to get vaccinated, because we're around each other, so it's less likely to spread with higher rates of vaccination on the public health level. Yeah. On the personal level, if you don't get vaccinated with COVID and you have asthma, COPD, chronic kidney disease, you're more likely to be hospitalized, end up in the ICU, or die. So it's straightforward that it is even more relevant in my eye for the African American community to be very focused on being vaccinated, both personally and as a community.
Excellent.
I would love to add to that.
Oh yeah, go ahead, Dr. Caldwell.
I would love to just add to that, because it's something Dr. Renee started on earlier, talking about comorbidities and our older folks that have some other illnesses, underlying illnesses. And then Dr. Brooks is getting at it too. But one thing, folks have opinions about vaccines, or they don't want to be vaccinated. They're not sure what to believe. They're not sure information is trustworthy. So number one, you talk to your physicians, you talk to your pharmacists. They're going to tell you straight up what's the right thing to do for you, and they've got access to information. But if you're not interested in being vaccinated, but you are interested in taking care of your other health conditions, you need to know that vaccination is helping you take care of your other health conditions. Because to Dr. Brooks's point, if you have comorbidities like heart disease, liver disease, kidney disease, then if you don't prevent the illness and you get sick, then those other illnesses are also going to be exacerbated. You're going to be your high blood pressure is going to be worse. Your kidney disease is going to be worse. So it's important to think of it as holistically, that being up to date on your vaccinations is a part of your overall health care. So if you're caring about the other things, this is something you should definitely care about too.
Absolutely. And I love that, Dr. Caldwell. Yes, you are making sure that you're taking care of your whole body, right? We don't just, when we take a shower, we wash everything, right?
You're giving yourself the best chance.
Yes, absolutely. Absolutely. We have to. Dr. Williams, you wanted to add something?
Yes, I do think when you start talking about disparities in our community, the community of color, you can't really have this discussion without talking about the lack of trust that we have. Since the COVID vaccine era, more than half the patients that I see every day are nervous about getting vaccines. This is an era and a generation of information overload, good information and misinformation. And unfortunately, on that technology front, we in the healthcare, we're losing the battle. We are late. Right. We're being reactive rather than having been proactive. So now we're trying to catch up. And in the Black community, particularly, I trained at Johns Hopkins in Baltimore, where there were studies and things done on the Black community there without their consent. So when they come into the hospital, they're nervous. They're like, what you putting in my body? Is this part of a study? They hear the word study and they don't want to do it. But staying on topic, the point that I'm trying to make is that when it comes to vaccines, we've got to have that discussion with them and validate the fear and the mistrust and meet patients where they are to take them to see and to trust us enough to believe, listen, I want you to get this vaccine because you need this umbrella to keep you safe. You need this vaccine to keep your family safe, because they don't want to hear us tell them what to do. We have to provide the information and make a joint decision about what's best for our patients, and not judge them because they want to be cautious. That's a huge disparity thing too. People don't trust us. People don't trust doctors. They don't trust pharmacists. They don't trust us.
Right. And it's true, but having conversations just like this, where we are being open, we're being honest, we're getting the information out there. And that's why I just adore Bio and BDO for just coming together and you all just providing your expertise, right? Your expertise and your honesty and helping to provide the information so that our community can make an informed decision, right? That will help them. And I want to just stay right there with you, Dr. Anastasia, because you said they don't trust us. Our patients, they don't trust us. We have to acknowledge the mistrust. We have to acknowledge, I'm sorry, I'm a little off topic, but the conversation, it goes hand in hand, right? We have to acknowledge the harm that was done, right? Once we acknowledge that, now we can move forward. Correct? We can move forward. Yes, Dr. Brooks?
So what you said is crucial in that we have to, first of all, accept the fact that there is mistrust, not so much with the doctor, they actually trust Dr. Williams, to be honest with you.
It's the system.
They do. It's the system. And that's really, really important. And I just want to bring one thing to the fore, that there's this book called Medical Apartheid by a writer named Harriet Washington. And one of the things I found that it was so interesting was that there was a vaccine for smallpox back in the 1700s. Mm-hmm. And Thomas Jefferson got it to give, he tested it on his enslaved because there were concerns about the potency and how safe it was. He gave it to his enslaved, and when he saw nothing happen to them badly, then he gave it to his family. So we're going back 200 plus years, almost 300 years actually, that even something like utilization of vaccine were done on us as an experimental approach. So there is real reason for mistrust. That being stated, nowadays, the vaccines are safe and effective, and we have to hammer that message home. And when Dr. Williams says, and Dr. Renee says, Dr. Carter says it, in the pharmacy, Dr. Hill says, get it. Julie Caldwell, she says, okay, I'm running Walgreens. No, maybe not running all of Walgreens, but running a lot of Walgreens, saying we're here to get it. So we have to be very clear in our message. You got to look them in the eye. Mm-hmm. You need to get this vaccine.
Yep. I love it. I love it. So to Dr. Allison Hill and Dr. Julie, so with everyone's schedule, and we touched on this just a little bit. So with everyone's schedules being so busy, where can people most easily get vaccinated today? And what should patients know about accessing different types of vaccines year round? I know you touched on it a little bit, Dr. Allison, but just you and Dr. Julie, just bring it home.
Well, sure. Just something for everyone to know, nearly 90% of people living in the United States live within 5 miles of a pharmacy. So there's probably going to be a pharmacy very close to where you are. And pharmacies typically have longer hours than other provider offices, such as physicians or nurse practitioners or physician assistants. And pharmacies are open on the weekends. And what you can do is you can go to that pharmacy and get your vaccinations. There's a lot of tools out there. I know Walgreens has a locator where you can find the nearest Walgreens. CVS has a locator where you can find the nearest CVS. Pfizer has a tool where you can find places that are offering vaccines. My organization, American Pharmacists Association, we have a vaccine locator tool where you put in your zip code. In vaccineconfident.pharmacist.com, you can locate a pharmacy wherever you are in the United States and find a pharmacy that's offering immunizations. And
right.
I know that today we're talking a lot about our respiratory vaccinations, but year-round, pharmacists are giving vaccinations, whether it's in June or August or March, and there's a whole list. It goes from the Tdap, which is your tetanus, diphtheria, pertussis, or your meningococcal. All of these vaccines you can go and get at your pharmacy.
Love it. Dr. Caldwell, you want to add something?
Yeah, absolutely. I think Dr. Hill's right. You know, the pharmacist is very accessible, very knowledgeable, has access to your registry records with the state, so they can recommend to you what you have not had already. They understand your, the comorbidities and what medications you're taking, so they can recommend what's right for you, what's most important or prioritized today versus down the road. Like Dr. Hill said, it doesn't have to be only during the fall and during this respiratory season, but also the rest of the year. And also we take it one step further in that we meet you where you are. Do you want to walk in and get an appointment immediately? You can do that. You don't have to have an appointment. You can make an appointment online. You can fill out all your paperwork online. You can make an appointment now, a year from now at Walgreens. If you wanted to go get your flu shot today and make your appointment for next year because you're super organized, then you can do that. So we've made it, we really try to strive every year to make it easier and easier to walk in, get the vaccine immediately, make an appointment if you want to work it in with the rest of what you're doing. You're shopping at Walgreens anyway. You know you're going to the beauty department. You know that you like we carry the poppy drinks and the Olapops and everything that's super, super, fun right now. So you can get all those things at the same time while you go get your vaccine. And it won't take a long time, and you'll be set to go. And they'll also let you know, if you're going for flu or you're going for the COVID vaccine, they're going to talk to you about what else you're eligible for, and just go ahead and get it all done at once. Let's just go ahead and get it. Dr. Brooks talked about that at the beginning. They're all important. So let's just take care of them all in one visit and out the door and moving on with the rest of your life. And you can stay well through the holidays and enjoy yourself with your family.
Yep. I like that, Dr. Julie. So, okay, Dr. Julie, don't go anywhere because I'm not done yet. So there was confusion. There was some confusion about the ability to get certain vaccines, like the COVID-19 vaccine at pharmacies earlier this season. Yeah. What can you share to clear up that confusion, Dr. Julie?
Well, first of all, they're available everywhere now. But we did have a bit of a struggle in the beginning of the season. Changing authorities, a new panel on the ACIP that recommends to the FDA. A lot of struggles there because everyone was new. It's a new process, a new administration, and it wasn't clean. It was not a seamless process. So a lot of people were coming in they wanted to get everything at once. Like I mentioned, they came in to get their flu shot. They wanted to get their COVID shot, and it wasn't recommended yet. The manufacturers were waiting to have it delivered to the pharmacies, but it was the curtain hadn't been lifted, if you will, no stamp of approval yet. So that was confusing to people. And vaccines they're complex anyway. They're complicated. Right. That's why you have to talk with your doctor and talk with your pharmacist and understand what's right for you. But then when we have administrative or regulatory issues that come into play and maybe muddy those waters a little bit more, then people kind of give up because they're like, I don't know. I mean, I'm just so confused. There's so much out there in the media about what's right or what's not right. So I think you just have to find your trusted voice and your trusted source, whether that be your doctor or your pharmacist, and understand they can help you navigate this at any time of the year. Whether you're someone that's an early adopter and you want to go get your vaccines in September, then visit the pharmacy and they'll tell you, talk you through all of that and let you know, hey, we're waiting for the new strain to come out. So not quite yet, let's pump the brakes. Or if you're rushing to try to get it done now because you're about to travel for the holidays, they can take care of that too and navigate you through those different, channels of what's right for me what's available to me, what am I eligible for. So they just try to make it as easy as possible.
Okay, Dr. Brooks, you want to add something, and then we're going to go to Dr. Hill so she can add too. Huh?
Very quickly, what happened is that the determination was made via a tweet or a Instagram that COVID-19 vaccine was going to only be recommended for those 18 and up. So, okay, whoa. Then that changed. Then, importantly, the ACIP was one vote away from requiring a prescription for the vaccine. So these were just actions that were making it more difficult. So that was what was really happening. Fortunately, that didn't happen. The other thing is underscore the importance. The majority of vaccines given, especially for these respiratory vaccines, are given in pharmacies. So you just can't underscore how important it is to have access. I can remember last time I got a vaccine in my doctor's office. My pharmacist, I get texts. It's time for you to get your. I already got it, dude. But I just want to be very clear how important access at the pharmacy is right now.
Thank you, Dr. Hill.
Oh, I love to hear what Dr. Brooks said, because last season pharmacists were giving over 90% of the COVID-19 vaccines and the RSV vaccines and over 60% of the influenza vaccines. So it's just like, yes, everybody's coming to pharmacies to get their respiratory vaccines. But I want to speak on, as we talk to our families, as we talk to our friends, to people in different states may have different experiences when they go to the pharmacies. And just a little explanation about that. Pharmacists' ability to provide vaccines, they're not based on just the recommendation. They're actually based on state laws. So a lot of the confusion that we had the past couple months was because the state laws only allowed pharmacists to give the COVID vaccine, influenza vaccine, or RSV vaccines based on what the CDC recommended. So that's where part of the confusion. So when the CDC was not making recommendations, then pharmacists weren't able to provide those vaccinations. We're very glad and grateful that a lot of states took action. Their governors were taking action, their legislators were taking actions to include not just CDC recommendations for pharmacists to be able to follow, but those recommendations from our medical societies, the American Academy of Pediatrics, American College of Obstetricians and Gynecologists, the American Academy for Family Physicians. So now pharmacists don't solely rely on those recommendations for CDC, but they have these other organizations that they can rely on. I will say that this caveat, it's not for every state. So don't go telling your friends or your family member that's 2-3 states away, oh, well, I can go to my pharmacist and get this vaccine. It may be a little bit different in your state. And some states are still working on changing their laws where pharmacists have this authority. But just go ask your pharmacist, and they'll be able to explain further what they can do in their particular state. And I know some of you who are traveling for the holidays, I'm going to a completely different state. The rules are different. Sometimes you may just want to go pop in a pharmacy while you're home for the holidays if you haven't been able to do so just yet, and you may get your vaccine.
I love it. I love it.
Such a great point.
And yeah, that's a great point. Just reminding people about the different laws in the different states and all of that, and just talking to your pharmacist and your primary care physician. So, Renee, okay, we're coming to our last section of the conversation. Yes, this was so good, but all good things have to come to an end, but not yet. So, Dr. Renee, where can people turn for trusted information on vaccines, and how can we help people feel more confident about getting them?
Well, if you're here, then you're already in the right place. Black Doctor always has trusted messengers that are giving you factual information and will not give you misinformation. So make sure that you plug in. And if you're watching this, make sure, I don't care when you're watching it, live or recorded, share it with somebody, because this is information that everyone needs to know. You heard Dr. Brooks say people need to be vaccinated from the time that they can crawl until they hit the ground again. So therefore, can you please make sure you share it because somebody needs this information. Also, there are some doctors that are on social media that are providing factual information. I am one of them. You can follow me at Ask Dr. Renee. But and if you have questions, you can feel free to send me a message, inbox or whatever, DM. I will respond. I will get you to somebody who can help you if I can't help you. But it's really important. I really wanted to say this. I receive and I see people share misinformation all day long. When you see things that say strange things, please make sure you check the source.
But Dr. Renee, it's Uncle Bob, and I grew up with Uncle Bob. And
I get it.
He goes to Dr. Google and Dr. TikTok, and I just trust Uncle Bob wouldn't lead me wrong.
But Uncle Bob, that might not be his expertise. Like my dad knows cars, but he also knows that I know health. So therefore, when there is a car situation, I call my dad. Dad, the car is puttering and doing this, and this, and then likewise. Although I will tell you, my parents don't often listen to me. But look, now they're older, and I'm power of attorney and all of that stuff. So look, so now I really take control, but. I am the one that I know this is what I know. I know what I know, and I know what you know. Just like my hair, I let the hairdresser handle the hair. You should just let the experts do their thing. And honestly, no, the doctors here will tell you they're not getting paid when you get vaccinated. I promise you, because I've seen that in the last week.
Get out of here.
That is not true. And I saw a doctor say it, and I was like, and you need to check to see who is that doctor. He probably is one of the people that works for the man at the AHHS. And I don't trust half of the people that work with that man, but for obvious reasons. So you really need to pay attention and just make sure you check the source.
Check the source.
Check the source. If you are listening to a veterinarian who takes care of cattle, talking about what should happen to you and your body, you should think about that. Just think about how that just may not make sense because they didn't go to school to treat humans.
Right.
So you think about these things. And I mean, you might have to do a little bit of deep diving, but pay attention. Is it a reputable publication? I mean, just all the things that you should pay attention to before you sit there and say, I am not vaccinating. And I will say I have had 7 COVID vaccines. I had the last 2, I think last month I had my COVID and my flu at the same time. I had one in each arm. Thankfully, I've never had any residual sickness or anything when I've gotten out of my vaccines, but I will also tell you that I do take 2 Tylenol as soon as I'm done. A nurse told me that, and that was good advice, I think, because I have never had any problems since. I can't tell you what happened when I was a kid, but that's what, as an adult. And I've had all my vaccines at Walgreens, and I've scheduled them all on my telephone probably less than 24 hours before I had them done as well. So it is very, very, very convenient. Walgreens is a huge thing in Chicago. Most people know we have a lot of Walgreens. And so you schedule it on your phone. It's easy peasy, lemon squeezy, and you go get it done. And it's easy as can be. I don't know the last time I went to a doctor's office and had a vaccine. I was probably a child. So yes, it is the drugstore. And they give you all the information. It's a fabulous process. I even have an app that has all the vaccines and the dates and everything in the Walgreens app. Also, because I keep going there, they keep track of all of them, and I can go look at it and print it and send it to whomever it needs to be sent to for whatever reason. So they make things way too easy, but you have to figure out. Another thing I also wanted to mention in COVID vaccines came out, and I live in Chicago, and on the south side of Chicago, they had COVID vaccines. And do you know that there were people that were not Black coming way to the south side to come and get COVID vaccines? Now, if that doesn't tell you that we need to get those vaccines, I don't know what does.
Yeah, same thing happened when I was working in Washington, D.C. at the Rodham Institute. So big up to the Rodham Institute, which is now at Georgetown. But we worked with Southeast Tennis and Learning Center in Southeast DC, and it was called Don't Miss Your Shot. And you had to show proof of your zip code. And we actually had to turn people away because that zip code. They didn't live there. And it was kind of like, oh my gosh, like, wow, these are the folks that is for.
The same thing happened with me. I was chief medical officer of Watts Health in Watts, and we were seeing people coming down from Beverly Hills to get their vaccine. It's like, okay, well,
how things change.
So the question was, where do you go for information? So the answer used to be, first of all, go to the first place, and the best place was the CDC.
Mm-hmm.
So to be very clear, that is no longer the answer. Unfortunately, I was on ACIP and I saw what happened inside. They're meeting 2 weeks from now. It's going to be some strange things coming out of that meeting, I believe. But Dr. Hill mentioned the best places to go, but unfortunately, it's becoming fragmented, and the general public does not know well. American Academy of Pediatrics, American College of Obstetrics and Gynecology, American Academy of Family Physicians. They have their own recommendations because they cannot trust the CDC.
Right.
So that's the best place to go. The other place to look at for a lot of us is your public health department, state or county.
Yes.
I don't know what's happening in the public health departments in other states. I'll just say red states, because I honestly don't know. But I know that that's a great source in many states. So those that are out there, the public listening to this, look at your county, city, state public health department.
Mm-hmm.
They will, I believe they will generally have reasonable recommendations on vaccines. But the simple thing is vaccines are safe and effective. It's not complex.
Right.
You know, if whoever you are, since you can hear this and understand it, you need a COVID vaccine and a flu vaccine.
Right.
RSV gets a little trickier, but it's not real tricky. So, I mean, you can look for information, but all the other stuff you're hearing, generally speaking, is mis or disinformation. The only contraindication to a COVID vaccine is a bad reaction to a prior COVID vaccine, period. So all these things that are stated are more or less improper.
I hear you.
I
I
would-
hear you. Did you want to
also add on?
Okay.
I'm sorry, Dr. Carter.
No, go
I
ahead.
would just add on, we talked a little bit about, getting sick with vaccines or having side effects. And these vaccines are also, not only are they safe and effective, but they're also very, very well tolerated. And you may have mild side effects like a low grade fever or pain at the site of injection, or maybe you feel a little fatigue. But I can tell you, it is better than getting a bad case of COVID. It is better than getting a bad case of the flu. It is better than getting shingles.
It's better
Shingles
than dying.
is very debilitating.
Right. Or measles. Right.
Yeah, it's very, and so in preventing the resurgence of those diseases like measles and polio and the things that we feel like we've eradicated is also very important for the public health. But feeling a little under the weather for a day or two is a small price to pay, and most people don't. Most people feel nothing. Most people have no side effects whatsoever. And I did hear a really great analogy this week about vaccines and what they're like a teacher. Your body's like a student. The vaccine just teaches your body what to do when it sees that bad guy. So when the bad guy comes, your body now recognizes it, and your teacher taught you what to do. So you're protected. So you've got a couple of good analogies here with the umbrella, the teacher. I mean, this is good info.
I know we're wrapping up. I just got to say this one thing, Dr. Shanti. I see the clock. I think one of the most effective things for me when I talk to a family about vaccines and they have a lot of questions is to listen to what they're saying, acknowledge it, and then when they ask me, well, did you get the flu shot? I'm like, me? Oh, absolutely. I ain't got time to be sick. I'm not trying to miss no work. And all my kids get the flu shot because we're not playing that. And when they hear that, did you get the COVID shot? Oh, absolutely. Did your kids get the HPV shot? I don't want my daughters to get cervical cancer and my sons to give it. Absolutely. We're not playing that. And when they hear that you're living what you're preaching, and it's not something that you're saying because you're supposed to say it, right, Dr. Renee? It makes such a big difference. It's all about trust. We have to figure out, we can't even trust the CDC anymore. Like Dr. Brooks said, how do we expect lay people to know which social media influencer is the one, which website is the one? What you got to do, and this is one message I'm going to leave, Make sure you find somebody who understands real research and science in medicine, pharmacy, that you can at least have the discussion with that will allow you to express your fears, your concerns, and come to a conclusion together. Find someone you trust. We're not preaching at you, get the vaccine, get the vaccine. Do what's best for you. But me and mine, we're getting the vaccine.
That's right. That's right. And I know that's right. And I've been vaccinated as well, because my thing is, just with BDO, we travel so much and people laugh at me because I had on a mask, and someone saying, "Oh, but COVID's over." It was, someone next to me was like, "No, it isn't over." And then they proceeded to cough like a velociraptor.
Yeah.
If you've seen Jurassic Park and the velociraptors, how they talk to, they're like, that's what it sounded like. It was, oh my gosh, so gross. Made my skin crawl. Right? So we have to continue to protect ourselves and to protect each other. Wear your mask. I don't care. Mask up. Wash your hands. Yes, I just clapped. Wash your hands. I don't care. Oh, well, no, you should have been washing your hands before. Wash your hands. If you're touching your nose, wash your hands. After you use the restroom, wash your hands. Happy birthday to you. Happy birthday to you. Wash your hands, okay? When you cough, covered like Batman or a vampire.
And when you sneeze,
that's
too.
how you do it. Yes,
Sneeze
when you
too.
sneeze. Yes, hand sanitizer. All of that, it keeps us safe, you guys. It keeps us safe. You cannot continue to do that. And also, you guys, I'm going to say it. That's gross. That's gross. That's gross. Would you want me coughing into the camera with droplets? And don't do that. That's gross, right? So we want to make sure, yes, this is the public health person coming out. Let's keep ourselves safe, okay? Practice good hygiene so we can keep ourselves safe. So my last question, because we did touch on the other two. So I want this for everybody, a one-sentence answer. What's one thing you recommend people do to stay informed and up to date on vaccines for themselves and their families in the new year? I'm going to start with you, Dr. Williams.
I said it already. Find somebody that you can trust, that understands the science world, medical science, that is open to having a discussion with you to help you better understand what you should do as the new recommendations come out.
Oh no, she froze. Okay, I'll say I agree with Dr. Williams. I would say, please find somebody that you trust, that you can have a discussion with. And hopefully that's your primary care doctor, pediatrician, or whatever. But everyone should have a doctor that's their doctor, and you should trust that person immensely enough to be able to ask questions, and they should be able to answer them.
Okay. Next,
I'll jump in there and say that I agree. Also, find someone that you can trust that has the expertise to be able to give you advice, and don't believe it just because it's on social media. There's a lot of information out there, and there's a lot of people
Dr. Julie.
They've got a PhD in Google, but find someone that's actually educated and knows how to interpret studies and can help you to understand the information that you're reading. Yeah, it's really, really critical.
I was going to say, Dr. Julie, say that again for the people in the back. Say it again.
Yes, definitely don't trust it. You cannot believe it just because it's on TikTok.
Right.
That's right. That's right.
I agree with what everyone else has said about finding that trusted person to talk to, but also put your vaccines on your list of questions when you go talk to your pharmacist or when you go talk to your primary care provider or any of your doctors. They can have those conversations with you also and help you figure out some of those questions you have. It's okay to ask your your providers about the vaccines you may need, or something you saw that may be misinformation, just ask them that question. Don't be afraid. Show them the TikTok or Snapchat video, and they can give you a recommendation based on what's true and what's scientifically correct.
I love it. Bring us home, Dr. Brooks.
I'd say don't fall for the okie doke. There's a lot of that out there. I would say that vaccines are safe and effective. I would say you should have a good relationship with a doctor, your primary care doctor, because it's about everything in terms of your health. And then finally, find a trusted source like a Dr. Renee or others. And just remember, vaccines save lives.
Yes, they do. And with that said, I would like to thank our esteemed panelists, Dr. Renee, Dr. Caldwell, Dr. Allison, Dr. Williams, and Dr. Brooks. And of course, we have to thank our sponsor, Bio, for this power-packed conversation about vaccines. So it is my hope that as you listen to the great expertise that was provided by our panelists, that you will take that information, study, and make an informed decision and keep yourself safe. Because if you're safe, then others are safe. Think about as we're riding on the plane, when that mask comes down, you put it on yourself first. So once again, my name is Dr. Ashanti Carter, and on behalf of BlackDoctor.org, thank you so much and continue to stay great. Bye.